Tell me what brings you in today.
Well, she brings me in.
I feel that there's some issues that I feel just need to be addressed. He doesn't want to be here, but I just feel that there's some things going on within himself, and it's troubling his life, I feel, with his work and our relationship. He is battling within himself some stress. We did have an accident, and that's just something that we're still dealing with, and he is also still dealing with.
Can you tell me about that accident?
Well, I'm an EMT, and I was at work, working night shift, and we were on the scene of an accident. It wasn't too bad, minor injuries. I was treating a patient, and then out of nowhere, an idiot ran into the back of the ambulance.
How long ago was that?
It's been a few months.
And what have you noticed has been different since the accident for you?
Well, I haven't been sleeping too well, and I'm having a hard time working night shift. I've done everything I can to get off of night shift.
And what's hard about working night shift these days?
I don't know, it just bothers me.
So when you say you're having a hard time sleeping, are you having a hard time falling asleep, or do you fall asleep and wake up?
Both.
Both. And what about nightmares? Do you have nightmares?
I dream of the accident every now and then, I have a lot of dreams.
So you're not feeling very rested these days.
And, people tell me I'm a little bit irritable. And I guess, that might be a little right, but it's probably because of the lack of sleep.
What are the kinds of things that irritate you or set you off?
I cut in. Sorry, babe. He used to laugh things off. Everything used to be very easygoing. But now I feel like I have to walk around eggshells with him. Everything. It's little things. I have to drive for him now all the time. He doesn't want to drive at night. He will occasionally, but I can just see it in him that he tenses up. His knuckles are white. There's moments where he'll just be sitting there, staring off, not saying anything at all. I know he's not there. And then all of a sudden, just screams, hits himself, and exits the room. And at night, it doesn't happen often, but it does happen. He'll wake up screaming, and it freaks me out. And I just want to move past that. I want to be able to grow with him.
I guess one thing that's bothering me a lot is that this is my job, I do this all the time, and I've been on terrible scenes before, and nothing's ever really bothered me like this.
What do you think it was about this scene, this accident, that was hard for you?
Well, it was, I guess that we were actually involved. I wasn't just there cleaning up.
So it was different for you because in your job, you usually come after the accident and step in and help. And you were in the middle of helping in an accident that you thought was over, And then an accident happened to you, something very unexpected and something very scary. Do you remember what that was like when that person hit the ambulance?
It was carnage. It was, it was loud, tires screeching, just metal crashing, glass breaking. It was, blood everywhere from the driver.
It sounds very terrifying, the whole experience. I noticed that you were shaking your head when your girlfriend was talking. What was that about? Well, she was telling me what's been going on with you.
Well, I think she's overreacting a little bit. She just needs to understand that I have a stressful job at times, and I'll get over this.
How long have you been in your job?
12 years.
And this is the first time anything like this has happened that's affected you to this degree? Or have there been other things?
I'm sure there's other things, and this makes me think of, just death.
Mm-hmm. Right. You were so close to it in a really different way than you usually are in your work. Literally physically close to it.
Yeah, you can say so.
Do you wonder if something could have happened to you?
Oh, I barely escaped.
It is significant that the client only came into the session with the urging of his girlfriend. Note that he appears reluctant to disclose much information and seems to minimize the impact of the accident. This is not uncommon with military, police, firefighters, and other first responders, where intense events are part of the job and acknowledging distress may be seen as a sign of weakness. We have preliminary information, some of it provided by the girlfriend, that suggests a possibility of PTSD. Gaining information from family members or others is good practice, assuming permission is granted, especially when the patient has a hard time reporting symptoms or is minimizing secondary effects of those symptoms, as in this case.
So how are other areas of your life? How's your appetite these days? How has that changed?
I don't know. I'm not as hungry. I guess, I don't know. I've been having some stomach issues.
Mm-hmm. What have you noticed, Valerie?
Well, as far as, when we're working, I'm a nurse in the emergency area, so I was there when it all happened, as far as him coming in. But it's when we're working, they're always long hours.
Mm-hmm.
So, just in our job, sometimes we don't have time to eat in general. So it's kind of hard to say, I know that, but at night, like I said, it's when we are having dinner together or just family time. I have a son myself, and he has children, but I just know that when we are all eating together, like I said, I feel sometimes he's not there. So, it's kind of hard to say, but also at the same time, I know he's struggling within himself, and I want him to be more present and not in the past.
She needs to realize that after the fact is a whole lot different than actually being there. And that's one thing I try to tell her. She just doesn't understand.
I understand. It's just I want you to
You said you were
grow.
You're right there. Yeah, I know you see it.
I do.
You are not right there whenever.
I was there when you came in.
I was almost killed that night.
I know. I was there when you came in.
So this has really affected you personally, and it's really affecting your relationship, which is, it sounds like Valerie's very concerned for you and cares about you enough to have you seek some help. And I appreciate that you've come in because you certainly didn't have to. What made you decide to come in with Valerie today?
Well, it's not only her telling me that I've been kind of on the edge of my coworkers. And I guess they're right. I am a little on edge, but things happen and I'll get over it. That's the way I see it.
Do you see things getting better as the days and the weeks pass?
I don't know.
So tell me what you do for fun.
Well, I try to stay active, jog, and ride my mountain bike.
Are those things you've been doing since the accident?
I haven't had time to do much of that.
I also wonder how your energy level is to do something like that. If you're not sleeping well.
Well, I know they're not good for you, but I drink those energy drinks, to try to keep alert. But
Did you used to do that before the accident?
every now and then, but
Not as much as he does now.
So you find yourself drinking more to try to keep up. What else are you noticing about yourself at work? You said some of your colleagues are concerned about you.
well, I'm just kind of on edge. They've said similar things, like she said. I used to joke around a little bit more, I guess. Now people just seem to kind of irritate me a little quicker.
And what happens when you get irritated with people, either at work or at home?
Well, I do get angry, and I tell people just leave me alone, but they keep pushing. Everybody likes to push.
Right. So people are worried about you. That's what I'm hearing. I'm going to ask Valerie what her experience has been when you've been angry. Because sometimes our experience is different from what other people see. So that's important for me to know.
As far as him saying pushing, I think it's just more I think he doesn't understand that we're wanting to help him. It's kind of funny to say, but it's like, not necessarily, it's more, he gets mad over, spilled milk, and it's a total accident, it's the smallest things, and, it's trying to just being like, it's okay, it's fine, it's straining, because we used to laugh, at just silly things, and I want to comfort him. I want to be there, so he doesn't feel like this. It is hard on me, excuse me. But again, I think it's something that he has to deal with at work, and it's a hard job. It is. You see people die every day, and he finally, I know, saw that in front of him, but again, I want to grow from that. I want him to feel better, and I don't want it to be strenuous on us or anything for him in his life, so it is hard, and I try to move past it again because I want to understand how he feels and how everything's going, but it's hard. It's hard.
It must be very hard to have had this happen at work, and then you have to go back to work every day. So you're going back to the place or the circumstance of this traumatic event, even if it's not the physical site, it's related to your work. I wonder what that's like for you.
I don't know. I have found myself avoiding the scene.
How do you do that at work?
Just take a different route. Might take a little longer to get there, but I'd rather not be on that corner.
Is there anybody at work that you've been able to talk to that has maybe helped the situation?
Oh yeah, I mean, they're very understanding. We've talked about it.
How would you want to feel differently?
Well, it seems like the anxiety is kind of getting to me. You know, we were at the movies the other night. Just, I usually like action movies. And with screeching tires and stuff going on in the movie, I couldn't be in there. You know, I can't enjoy the things that I used to enjoy.
Right. To really hear that you're not enjoying life these days, that since this accident, that you've really had a lot of trauma from what happened. And really anybody in your situation, whether they were an EMT or not, it was a really, really scary thing that happened.
But it shouldn't be affecting me like this.
And what makes you think that?
Because this is my job, this is what I do.
Your job entails helping people. It doesn't entail being run into every day. That's not a regular part of your job, which makes sense to me that this has affected you in a very profound way. Anybody in your situation, any colleague in your situation could have easily been affected the same way. Doesn't have anything to do with how good of an EMT you are, how much experience you have. It's a really scary event. And it sounds like you've continued to have a hard time. And your girlfriend and your colleagues are worried about you. And it sounds like they would also like you to begin to feel differently and feel better. This is a common reaction to someone who's witnessed something that you've witnessed. And there are ways to help you cope with it and get through it so that you won't forget that it happened, and then it won't affect your life like it's affecting you now. And if you're interested, I'm happy to help you and meet with you alone or meet with Valerie together and see if there's some things we can do to help you get through this and to start feeling some joy again in your life and some normalcy. What are your thoughts about that?
I guess it'll be all right. I mean, I don't see how just talking to somebody's going to help me. But.
Well, we'll do more than just talk. There's other things that we can do that can be helpful. We can talk about that the next time. But I appreciate your willingness to come in. I understand that it took a lot for you. And I think I can help you. So we'll make another appointment for next week and find a time and